Welcome, and thank you everyone for taking the time to watch this information session about how to keep your teens safe around prom and graduation season. Over the next hour, you'll hear different topics around substance misuse, distracted driving, and tips on how you as a parent, caregiver, or adult mentor can talk to youth in your life around how to stay safe during different circumstances. We have a great group of people here to present this information. Both myself, Darren Smith, and my colleague Andrea Smith are community health partnership coordinators with Dartmouth-Hitchcock Medical Center, and we represent the Greater Sullivan County and the Upper Valley Public Health Networks. In these roles, we work with the community to promote substance misuse and suicide prevention initiatives, education, and support, with a special focus on the youth population. We also have Lexi Blag here, which is the Youth Operator Program Coordinator in the Injury Prevention Center at Dartmouth-Hitchcock Medical Center. A part of Lexi's role is working with teens, parents, and caregivers and school systems throughout New Hampshire regarding educational material and support around safe driving for youth. Finally, we have Carrie Rockford Haig, who is a senior prevention educator at Turning Points Network, and she is also the Shine educator at TLC Recovery Center. Carrie does a lot of work educating the community around topics relating to sexual health and safety. The overall agenda for this training started off by me introducing you to our 4 subject matter experts who will be presenting this material to you. Next, we will get into our content around state and national statistics, transition into information around distracted and impaired driving, follow that information up with some useful tools that you can use to keep your teens safe with specific examples and information from the SAMHSA's Talk They Hear You campaign. And then we will also have a portion around consent. We're going to be sharing a lot of great information with you. And if you have a question that you would like to ask the group, you are welcome to email us at info@uvaltogether.org. You'll also find contact information at the end of this presentation and under the description of the video. You will also have access to a Keeping Your Teens Safe toolkit with resources around these topics as well. Okay. We are almost ready to start, but let's go over a few objectives that we hope that you'll get out of this session first. These objectives are to understand relevant state YRBS statistics and where to find these reports, understand the data and dangers around distracted and impaired driving, develop tools to keep your teen safe while on the road and at parties, know how to access the Talk They Hear You campaign, develop ways to talk to your teen about topics around substance misuse prevention and driving safety, and understand what consent is and why it is so important. So this presentation goes over information from the YRBS, or the Youth Risk Behavior Survey. This survey is conducted nationwide with the Centers for Disease Control and Prevention, also known as the CDC. It is conducted every 2 years across high schools, and middle schools can opt in to take it as well if funding is available. This is a completely anonymous survey, so youth are able to answer honestly without the fear of anyone else finding out what they answered. The overall goal of this survey is to gain a better understanding of trends, issues, or additional support needed for the youth population around different topics. The survey monitors 6 types of health risk behaviors that contribute to the leading causes of death and disability among youth and adults. These include behaviors that contribute to unintentional injuries and violence, sexual behaviors that contribute to unintended pregnancy and sexually transmitted diseases, alcohol and other drugs, tobacco use, unhealthy dietary behaviors, and then inadequate physical activity. The data from the YRBS is used extensively by health departments, schools, local agencies, and other organizations to define areas of high health risk and to secure the resources necessary to address any identified issues. With the YRBS taking roughly a year for the results to come in, we work as quickly as we can to analyze the data provided to help develop appropriate programs and services that positively influence youth. Some examples of this can be additional mental health support for youth, increased access to food, or education around the dangers of drugs and alcohol. So over the next few slides, we'll be using the most current YRBS data, which was collected in 2021. The 2023 YRBS results is currently being administered within schools in New Hampshire this spring of 2023. So getting into New Hampshire specific data, this table here shows a comparison of past 30-day use of substances, including alcohol, marijuana, prescription medication, and then electronic vapor products, also known as vapes. As you can see, New Hampshire's youth reported higher uses of marijuana than the national average, while they responded lower uses of consuming alcohol, prescription medication, and then electronic vapor products than the national average. 21% of youth reported currently drinking alcohol, 18% reported currently using marijuana, 14% reported current vape use, and then 4% reported current use of prescription medication without a doctor prescribing it. I'd also like to add that in New Hampshire, 11% of youth also reported binge drinking, which is consuming 4 or more drinks in a row. I'd also like to briefly mention that a CDC study has shown that roughly 99% of all vapes have some amount of nicotine in it. These devices can also have THC in it, and many illicit drugs can also be vaporized and added into the device, according to the National Institute on Drug Abuse. So with that, it's really essential that parents and caregivers talk to youth around the dangers of vapes, as well as other substances like alcohol or other drugs. And we'll be going over some tips to do that later on. This slide over here goes over ease of access for different substances, and you can see that in New Hampshire, 56% of youth felt that it would be very easy or somewhat easy to get alcohol. 45% thought that it would be very easy to get marijuana, and 16% thought that it would be very easy to get prescription medication. Across all 3 substance types, youth reported decreased rates of ease of access compared to the 2019 data, which is a great start, but we still want youth ease of access to substances to be lower than what it currently is. In New Hampshire, 9% of youth reported being physically forced to have sexual intercourse when they did not want to, which is roughly 1 out of 11 youth. 4% of males and 14% of females have been forced to have sexual intercourse without consent. You can see here that sexual violence has increased from 2019 to 2021. No one should ever be forced to have sex when they do not want to, which is why learning about consent is so important. And later on in this presentation, Carrie Rockford-Haig will be teaching us about consent, why it's so important, and then how to navigate it. When it comes to impaired driving, 25% of New Hampshire youth has texted or emailed while driving, 3% drove while they have been drinking alcohol, and then 15% drove in a vehicle driven by someone else who had been drinking alcohol. Although some of these numbers have decreased since 2019, these numbers are still far too high. And if you're anything like me, you will think that these impaired driving stats are really scary. And I think that oftentimes people just simply don't understand what impaired driving is. So luckily, our youth operator program coordinator, Lexi, is here to go over what impaired driving and distracted driving is and how to lead by example. So take it away, Lexi.
Thank you, Darren. For your teens, being a new driver is a big responsibility. So it is important to feel confident that you and your teen are ready and prepared for them to take on the road, especially around events like prom and graduation time. I hope this information helps guide you in having these conversations with your teens. So let's get started. According to the Center for Disease Control and Prevention, impaired driving happens when someone operates a vehicle while impaired by a substance like marijuana, other illicit drugs, some prescribed or over-the-counter medications, or alcohol. Impairment continues to be a leading cause of motor vehicle crashes. In recent years, almost 40% of all crashes in New Hampshire involved driver impairment. This is very concerning because impaired driving is entirely preventable. Often when we think of impairment, we think of alcohol. In recent years, the opioid crisis in New Hampshire has resulted in increasingly higher numbers of impaired drivers. Additionally, as many states across the country legalize recreational marijuana, it is increasingly easier to obtain and its effects are often misunderstood. It is important for teens to understand that if a driver's mental state is altered by marijuana or other substances, they are driving impaired. About 1 in 14 car crashes involves an underage drinking driver. And marijuana users were about 25% more likely to be involved in a crash than drivers with no evidence of marijuana use. On the left is a chart showing the effects of blood alcohol concentration. Being able to identify or understand this could save your teen's life or their friend's life. On the right is a chart showing how long substances can remain in your system. It is important for you and your teens to understand how long a substance can remain in someone's system. As you can see from this chart, marijuana can stay in someone's system up to 7 days, and alcohol can last 1 to 3 hours after your last drink. However, please keep in mind this can all vary depending on a person's age, weight, and additional factors such as physical health and dose of the substance. There is no way to completely predict how long a substance will take to be completely eliminated from someone's body, so it is best to not engage with any kind of substance. We know a lot about alcohol's effect on driving, but some research has shown that both legal and illicit drugs impair the skills needed to drive safely, such as being impaired by marijuana can affect your reaction time and decision making, impaired coordination, and distorted perception. Other drugs, such as cocaine, can impair skills like perception, memory, and attention in the short or long term. Prescription and over-the-counter medications can cause side effects such as sleepiness, impaired vision, and impaired coordination. Did you know driving while impaired or driving while intoxicated, DWI, can cost a minimum of $10,000? Please note that is a minimum cost because that does not include lawyer fees, vehicle towing fees, and other violation fees that may come up. In addition, you will have to pay for a breathalyzer to be installed and removed in all vehicles. Under the New Hampshire Ignition Interlock Device Law, also known as NHIID, a driver must install the device shown in this picture in every vehicle that they use on a regular basis. For some people, this means having multiple devices if they drive more than one vehicle. The device must stay installed for 1 to 2 years. The initial installing fee can be between $70 to $100, with a monthly fee of $60 to $90, and then another $70 to $100 fee for it to be removed. And lastly, your insurance payment will go up a substantial amount. All of this is just not worth it. Talking to your teens about this process can be eye-opening because there are serious consequences behind impaired driving. We know that it is illegal for teens to consume alcohol or use substances, but if they find themselves in a situation, here are some tips for your teens. Have them plan a safe ride home. Have them understand the effects of alcohol so they can identify when someone has been drinking or using other substances and not letting their friends get behind the wheel. At any point, let them know that it's okay to call you for a safe ride home. Always discuss the importance of wearing a seatbelt when they get into a motor vehicle, as a seatbelt can save their life. If your teen sees an impaired driver on the road, have them contact their local law enforcement because their action could save someone's life. Alcohol-impaired drivers get behind the wheel millions of times each year. Although your teen may not be involved in this behavior, they should be aware that impaired driving is unfortunately happening on our roads. So let's shift gears towards talking about distracted driving, because as Darren mentioned earlier, the Youth Risk Behavior Survey for 2021 is showing that 24% of teens are reporting that in the last 30 days they are texting or emailing while driving a motor vehicle. Distracted driving also continues to be a leading cause of motor vehicle crashes, the same as impaired driving. According to the National Highway Traffic Safety Administration, distracted driving is an activity that diverts attention from driving. The three main types of distracted driving is visual, manual, and cognitive. Visual is taking your eyes off the road. An example would be playing around with a GPS device. Manual is taking your hands off the wheel. An example would be eating or drinking or adjusting your seat. Cognitive is when you take your mind off of driving. This looks like talking to a passenger or talking on your phone. Any non-driving activity your teenager engages in is a potential distraction and increases their risk of crashing. According to the New Hampshire Office of Highway Safety, there has been 42 fatal crashes with distractions from 2014 through to 2020. New Hampshire does have a hands-free law that went into effect on July 1st, 2015. Violating the hands-free law can result in the following fines: $100 for the first offense, $250 for the second offense, and $500 for a third offense. That is a total of $850 just for violating the hands-free law. It's not worth it. Reaching for something in your car increases your chance of a collision by 9 times. While driving, it is important to know your surroundings. About 1 in 5 of the people who died in crashes involving a distracted driver were actually not in vehicles. They were walking, riding their bike, or otherwise outside a vehicle. Teens who text while driving spend 10% of their driving time outside of their lane. At 55 miles per hour, sending or reading a text is like driving the length of a football field with your eyes closed. Teens who text or email while driving were also more likely to report other transportation risk behaviors, such as more likely to not always wear a seatbelt, more likely to ride with a driver who had been drinking alcohol, and more likely to drive after drinking alcohol. Best practice for anyone, especially your teen, who has less driving experience, is don't drive distracted. Hands on the wheel and eyes on the road. Now that I have provided some information around impaired driving and distracted driving, I'd like to remind everyone that we can get involved and all play a part in keeping each other safe and fighting to save lives. Here are some great examples to get involved, support, and guide your teen to being a safe, responsible driver. First off, teens can be the best messengers with their peers, so we want to encourage them to speak up when they have a friend indulging in risky behaviors while behind the wheel. For example, we want them to put their phones away while driving and helping them find what works best for them, such as having them put their phone on Do Not Disturb while driving, silencing their phone and putting it in the middle compartment, whatever it is that works best for them. And then next is you, the parents and caregivers. You can lead by example by never driving distracted, never driving impaired, not speeding, and always wearing a seatbelt, and continuing to have conversations with your teens throughout their driving experience. Educators, such as Darren, Andrea, Carrie, and myself, can spread the word by partnering with New Hampshire high schools, community members, or workplaces around safety of teens, especially during the upcoming events such as prom and graduation. If you know anyone who feels strongly, such as your teen, such as yourself, such as anybody in the community, encourage them to be a voice in your community by speaking at community meetings, supporting local laws, and so much more around impaired driving, around distracted driving, around traffic safety in general. Lastly, always remember that you have more influence on your teens than you may think. Stay involved throughout the duration of their teen years and talk to your teens regularly about traffic safety. This concludes my section for traffic safety, and I thank you so much for taking the time to be here. As Darren mentioned before, if you have any questions, please send us an email at info@uvaltogether.org. Next up is Andrea, who will be discussing the Talk, They Hear You campaign and how to access that, and some tips on ways to talk to your teens about topics around substance misuse prevention. Take it away, Andrea.
Thank you, Lexi. Before we get into the tips for keeping your teen safe around these milestone events, let's think about why a teen might start to drink or use other substances. Factors like stress, peer pressure, or transitions might increase the risk of your child using alcohol and other drugs. But keep in mind that kids can be influenced by watching what the adults in their life are doing as well. So think about how you cope with stress, peer pressure, or life transition. And even though these factors may feel out of your control, there are things you can do to help your child. When it comes to stress, encourage your child to get involved in sports or other activities as a healthier way to cope with problems. For peer pressure, help your child learn different ways to say no. Remind them that real friends would not pressure them to drink or use other drugs. And for life transitions, reassure your child that things will get easier and make sure they know that drinking or using other drugs is not a solution. Let's continue to think about these life transitions or big milestones in a teen's life. Depending on your teen, things like ending a senior athletic season, going to prom, and graduating are probably some of the more significant events that we associate partying with. Healthychildren.org is a great resource for all things children from newborn to 18, and they have some great tips and things to keep in mind if your teen is going to go to a party. Communication and honesty are important to keep your teen safe. Teens whose parents talk with them regularly about drugs and alcohol are 42% less likely to use substances than those whose parents don't. So tell your teens that you expect them not to use alcohol or other drugs at parties. Know where your teen is going and how long they will be there. Have the phone number and address of the party. Make an agreement with your teen that they'll call you if the party changes, and be sure to let them know where you're going to be during the party. Call the parent of the teen that's hosting the party and make sure that a parent will be home during the entire time and supervising the party. Make sure that alcohol, tobacco, and other drugs will not be allowed. Talk with your teen beforehand about how to handle a situation where alcohol is available at a party. Practice ways to turn down when alcohol or other substances are being offered. Make sure your teen has a way to get to and from the party. Make it easy for your teen to leave a party by making it clear that they can call you at any time for a ride. Discuss why they might need to make a call like that. Remind them to never ride home with a driver who's been drinking or using other drugs. And we've heard other people say that they've come up with a code word or a phrase for their teen to use with their parent that signals that they're not comfortable and they want to leave without making it obvious to their friends. Be up to greet your teen when they get home. This can be a good way to check on the time, talk about the evening with your teen, and just see how they're doing. But if your teen is staying overnight at a friend's house after the party, again, verify this arrangement with that friend's parents and make sure that they're going to be home. But there are some things to keep in mind if you are going to be the one hosting a celebration or a party at your house. So plan in advance. Go over the party plans with your teen and encourage them to plan non-alcohol related group activities or games. Keep the party small. So we all know when a teen plans a party, news spreads very quickly via social networking sites like Snapchat or Twitter, and we know parties can start to grow too large for parents to control. So make sure at least one adult is present at all times and ask other parents to come over to help if you need it. Set a guest list. The party should be for invited guests only, no crashers allowed. So this will help to avoid that open party situation. Set starting and ending times for the party. You can check your local curfew laws to determine what an appropriate time would be to end a party. Set party rules and your expectations and discuss them with your teen before the party. Some examples of some rules could include no tobacco, alcohol, or other drugs. No one can leave the party and then return. Lights are left on at all times, and certain rooms of the house are off limits. Have plenty of food and non-alcoholic beverages available, and also put your alcohol and any prescription or over-the-counter medications in a locked cabinet. And we've heard this saying, be there, be square, but in this case, be there, but not square. So pick out a spot where you can see what's going on, but you're not necessarily in the way. All of these tips can help make sure that you're set up for a safe celebration. But there are some other things that you need to know when it comes to hosting teen parties. Parent networking is the best prevention tool to combat underage drinking. Get to know your teen's friends and their parents. If your teen is planning on going to a party, again, call the parents to ensure that they're going to be home and that they are not going to be allowing drugs or alcohol. If this is not possible, don't let your teen go. And parents are legally responsible for anything that happens to a minor who's been served alcohol or other drugs in their home. So if anyone brings alcohol or other drugs to your home, be prepared to contact their parents. And if someone comes to your home already intoxicated, make sure that they get home safely and help your teen to feel responsible for this as well. Parents may be criminally or civilly liable if alcohol is provided to a minor at a party that they've organized. If someone's property is damaged, someone gets injured, someone leaves and gets into a car accident or injures someone else, or if someone dies. So it's really important to understand local laws about alcohol and other drugs. And those laws vary from state to state, so make sure you know what the laws are in your state. In New Hampshire and Vermont, there is a $2,000 fine in addition to potential jail time. And while it's never too late to have conversations with your child about alcohol and other drugs, it's also never too early to start these conversations. Ideally, the best time to start talking with your child about alcohol and other drugs is before they're exposed. If you approach the conversations directly and honestly, your child is more likely to respect your rules and advice about alcohol and other drug use. Lots of little talks keep the lines of communication open and work better than one big talk. Youth risk behavior survey data gives us an idea of how youth think their parents feel about using these substances. So although it may not seem like it, research shows that young people really do listen to what their parents have to say about alcohol and other drug use. There are tools to help you have these conversations. Talk, They Hear You is a national media campaign that provides parents and caregivers tools and resources to have conversations with their kids early and often to prevent underage drinking and other drug use. The campaign is run by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and was launched in 2013. The Talk, They Hear You campaign goals are to help parents get informed, be prepared, and take action. Let's take a look at some of the resources from this campaign. Research suggests that one of the most important factors in healthy child development is a strong, open relationship with a parent. It's important to start talking with your children about alcohol and other drugs, like I said before they're exposed to them, even as early as 9 years old. So you can use these 5 conversation goals to help you get started, but again, keep it low key. Don't worry, you don't have to get everything across in one talk. So plan to check in often with quick chats and keep those lines of communication open. So for conversation goal number 1, over 80% of young people ages 10 to 18 say their parents have an impact on their decision whether to drink. Don't assume they know how you feel about drinking and using drugs. Send a clear and strong message that you disapprove of underage drinking and other drug use. Goal number 2, young people are more likely to listen when they know you're on their side. Remind your children why you don't want them to drink or use other drugs, because you want them to be happy and safe. The conversation will go a lot better if you're open and show your concern for their well-being. And you want your child to make informed decisions about alcohol and other drugs with reliable information about their risks and dangers. You don't want them to learn about alcohol or other drugs from bad sources of information. So make sure they know you're a trustworthy source of information. Goal number 4, young people are more likely to drink alcohol or use other drugs if they think no one will notice. Show that you're aware of what your child is up to, but do it in a subtle way and try not to pry. If you ask about friends and plans, it's because you care, not because you're judging. They're more likely to talk with you openly when you show that. And goal number 5, even if you don't think your children want to drink alcohol or other drugs, pressure from their friends can make it hard for them to say no. Having a plan to avoid underage drinking and other drug use can help children make better choices. Talk with your children about what they would do if faced with a decision about alcohol or other drugs. Practice saying no thanks with them in a safe environment, and again, keep it low key. We know it can also be hard to answer the tough questions that your kids might have. So here's just a few pointers when it comes to answering those questions. So they might ask, why are alcohol and other drugs bad for me? So rather than scaring your children, tell them that alcohol and other drugs are bad for their growing brain and can make them sick. If they ask, I got invited to a party, can I go? Remind your children of the rules around alcohol and other drugs and the behavior you expect. If they say, what if my friends ask me to drink or use drugs? Remember, helping your child say no to peer pressure is one of the most important things that you can do as a parent or caregiver. And then what if they ask, did you drink or use drugs when you were a kid? Just make sure to emphasize that we now know even more about the risks to children who drink or use other drugs than we did when I was a teen. These materials show parents using everyday opportunities to talk with their children about alcohol and other drugs and include tools to help parents start these conversations with their own children. Some of the resources include fact sheets on topics like how to tell if your child is drinking and answering the tough questions. It also includes brochures and infographics with in-depth information on alcohol and other drugs like cannabis and opioids. There's also a mobile app that's available to download for free on Android, iOS, and Windows devices. Practice scenarios share conversation starters, goals, possible reactions, closers, and other helpful information like statistics on the prevalence of underage drinking and other drug use. The scenarios begin with a PSA from the Talk They Hear You campaign, showing parents talking with their children about alcohol and other drugs based on one of the 5 campaign goals that we discussed a little bit ago. This scenario is then broken down to help you understand and plan for conversations of your own. You can earn badges for completing practice scenarios and for having actual conversations. And at the end of each scenario, you can record your own practice conversation and take a self-assessment. After exploring the app's practice scenarios and resources tabs, again, you can practice each conversation goal. So the recording feature allows you to record a practice conversation and then play it back to yourself to hear how you would sound to your child. The self-assessment lets you rate yourself on how well you achieved that conversation goal. And remember, we want to keep these low-key and low pressure. From the practice screen, you can also add reminders to your digital calendar to have conversations with your children. Screen for Success is a new and user-friendly virtual tool from SAMHSA's Talk They Hear You campaign. It's designed to help parents and caregivers better understand the health, wellness, and well-being of their children and find resources to address their needs. Screen for Success asks questions about substance use, mental and physical health, general well-being, and family life. It provides an easy way for parents and caregivers to identify areas where their children may benefit from additional support. Parents and caregivers are encouraged to fill out the screener with their kids, as it provides an opportunity for discussion in the moment, but if that's not possible, you can send it to them to complete on their own. The screening takes 10 minutes and looks for signs of elevated risk. The resources section then provides you with recommended support services that are available in your area as well as nationally. You can access it on your mobile device through the app that I just talked about, and you can find Screen for Success by selecting the screening button from the app's main navigation. So you've had the first conversation with your child. That's awesome. So remember, frequent conversations with your child about alcohol and other drugs help to keep those lines of communication open. And also remember, as children get older, the conversation changes. So make sure that you're giving age-appropriate information to your children. So how would you change the way you're talking about alcohol and other drugs to your 9-year-old versus your 15-year-old versus your 18-year-old about these different issues? Another resource for parents and caregivers is a series of short videos we created called Talking Matters, Navigating the Hard Stuff with Youth. These videos cover perspectives from a parent, clinicians, youth, and more. We know that substance use is a difficult topic to discuss, so we hope these Talking Matters videos will provide tools and information to help you or a loved one feel more prepared to navigate this part of your teen's life. Scan the QR code over on the right to visit our YouTube channel where these videos live. And now Carrie's going to handle talking with teens about consent.
Thank you, Andrea, for that really important information about so many critical topics to be talking with our young people about, and for the tips, how to have some of those conversations, and for all of the great resource information. My name is Carrie Rochford Haig, and I am a prevention educator at Turning Points Network. And Turning Points Network is an organization that provides support to folks who've been impacted by relationship abuse, domestic violence, sexual assault, stalking, and sex trafficking. We have an office in Newport and Claremont, and we serve all of Sullivan County. And we are one of 12 programs throughout the state of New Hampshire that provide similar services. So I'll be sharing some of that toward the end of the program, so that no matter where you are listening to this program, watching this program, we can help connect you to the Crisis and Support Center that serves your community. So today we're going to be talking about consent. And this is a topic we spend a lot of time talking with students about in the work that we do in schools, and also talking with parents and caregivers and educators about how to have some of these important conversations with our young people. So thank you for being a part of this and wanting to learn more about this. We know that we can reach further into the community and support more young people when we help adults to feel comfortable having some of these conversations. So I hope today you will leave with some tips and some resources to help you talk with young people in your life about consent. It can feel a bit daunting, this topic, especially if we're not used to talking with young people about it. But I'm hoping that I can help put your mind at ease a little bit at the beginning, and to say that there are many everyday ways that we can talk with young people about consent. And when we look for those everyday ways to help young people ask for permission and recognize boundaries and ask for consent, we're actually laying the really important foundations for further conversations about sex and consent. Right. But I think sometimes as parents and caregivers and educators, we think we have to go right there to that conversation. And we can start talking with children about consent from birth, really. And so no matter how old your young people are, where you're listening to this program, you might be thinking, oh, I wished I'd started earlier. Or you might be thinking, oh, I didn't realize I could start these conversations now. I want to help encourage you to start those conversations. Look for everyday ways, right? Things like when we borrow something from someone, right? Or when we want to touch someone, right? That we ask for permission before we hug people or put our arm around people, because sometimes we like touch and sometimes we don't. And sometimes it depends on who the person is that's wanting to touch us, and depending on how we're feeling that day. We ask for permission, right? When we want to take something of someone else's, right? And we can look for ways to reinforce when kids are already practicing good boundaries. So if you notice, right, your child like asking their friends permission before they go into their backpack and take a book out, right? Like, hey, Sarah, great job checking in with your friend, right? And asking for permission before you went into her backpack, because that's her backpack, right? And we want to respect other people's belongings. I like to really encourage parents and caregivers to use those opportunities around tickling and play fighting and wrestling, right, to talk about consent, right? So when they're tickling and play fighting and having a great time, and then someone says stop, right, that we can help them recognize that that's your cue, right? When someone says stop or no, we listen to that, right? Because your words matter. And when you say no and when you say stop, people should listen to you. You don't have to go further than that, right? That can be the consent lesson for that day. And then as your kids get older and you're having additional conversations, it won't be the first time they're hearing you talk about consent and boundaries, because you will have been reinforcing that along the way. Healthy boundaries, we talk a lot about how healthy boundaries help promote healthy relationships, right? And learning to be able to recognize boundaries and set boundaries and respect other people's boundaries, all are critical elements for healthy relationships. And we set boundaries all the time, right? Without thinking about it, right? In terms of our own body, in terms of our emotions, our work time, our free time, our energy, our space, and the way we communicate, our language, what kinds of jokes are appropriate around our house, and what are the jokes that we tell at work or when we're with a mixed crowd, right? We're always navigating this, what's okay and not okay okay, what's comfortable and uncomfortable. And the more we can help young people be able to recognize that, right? Like, what is the boundary in this environment? And what is the boundary? How do we recognize someone else's boundary, what they're comfortable with or not? Those are just really important conversations to have. And we set boundaries with lots of different people, right? Different settings, different situations, with friends, with family, with partners, right? With our coworkers, our colleagues, with teachers, right? Coworkers and even strangers, right? The kind of space that we want around ourselves when we're around people that we don't know, right? Chances are, if you talk with your young people about personal space, they'll talk about the personal space bubble. They may have had health teachers or guidance counselors talk with them about the personal space bubble. And it's great to help our children recognize that we don't all have the same personal space bubble, right? And so part of what we're learning to do is be able to recognize that in other people as well. So an image that we love to use in talking with adolescents about consent is this image from Planned Parenthood that says, "I love fries." And it's a fun way to have a conversation about this. So we go through each letter, right? What does that mean? Freely given. So the person's not feeling pressured. They're not feeling manipulated. They're feeling freely able to say yes or no. That it's reversible, that we can say yes to something and then change our mind, that we can say yes to something one time and then not want to say yes to that again, right? So it's completely reversible. It's not a one-time thing where you give permission once and then you don't ever have the right to be able to say no again. It's informed. So consent means that someone is able to really think through whether they want to say yes or no to that. This is really important, and we'll come back to this when we talk about alcohol and other drugs and how that interferes with people being able to give informed consent. It's enthusiastic. So it's not hesitant. It's not feeling pressured or, feeling nervous. It's someone 100% saying, this is what they want to do, right? And this is where that important ability to read other people's emotions and body language is so important. If someone is seeming hesitant, if they're seeming unsure, if they're seeming uncomfortable, it's a no. And we say to young people, if it's a maybe, it's a no. Because it's only yes if it's that 100% enthusiastic yes. And it's specific. So again, right, it might be that someone is giving consent to one activity, one sexual behavior, but they're not wanting to do something else. And so we can't assume because they said yes to one thing that they're going to say yes to something else. And for us to remember that consent is a learned language. And so just in the way that we helped our children learn to talk and read, right, and communicate, we're helping them learn how to navigate this language of consent. So we also like to remind young people that we ask for permission before we touch people. We don't assume that everybody likes to be touched or that they want to be touched. And we don't touch people who are unsure or hesitant, and we don't touch people who are saying no or stop. Again, go back to those kinds of earlier ways, everyday ways you can reinforce that, right? When someone says stop about whatever it is, we stop. Your words matter. And it's really important that we think about how the media, how social media, how peers can all influence young people's ideas about consent. What are the movies and the music and the folks on YouTube that they're following? What are they saying about these topics? How are they modeling boundaries? What kinds of things maybe are being said that are not showing respect for boundaries, or that are perhaps even making light of sexual assault or making jokes out of boundaries? And, we want to help young people see that this is not a black and white, right? That there's nuances to this. And this is part of the learned language. We want them to be able to recognize some of those nuances and help them to see how people in their lives might be giving them ideas about consent, some of which may be healthy ideas and some of which may not be healthy ideas. And why are these conversations so important? Right? Because we know the stakes are so high. We know that young people are at a higher risk for sexual violence. 1 out of 10 children experiences some form of sexual abuse before the age of 18. We know that young women ages 16 to 24 are in the highest risk category for intimate partner violence. 1 out of 5 women, 1 out of 16 men experience some kind of sexual assault in college. And we know that youth who identify as LGBTQ+ are at an even higher risk. They're at a three times higher rate of experiencing abuse. So the stakes are high, and we want our young people to know that this can be prevented. Sexual assault can be prevented, and it can be prevented by healthy relationships and having conversations about consent. And we also know that for us as adults, a lot of our modeling around this, a lot of what we learned might have been more around stranger danger, right? That sexual assault is learning how to be aware of someone who might be lurking in a park or jump out, from behind a bush. Statistically, young people are more likely to be hurt by someone they know and trust than by a stranger. So we want to talk with our young people about recognizing boundaries and respecting boundaries everywhere, and recognizing when they're uncomfortable, no matter who that person is, because statistically we know it's more likely to be somebody that they know and trust. And so if we're only talking about preventing assault as it relates to strangers, we're missing a really key opportunity to talk with them about where it's more likely to affect them, which is with their friends and their peers and people they're in relationships with and people who are friends of their family, and not strangers. I would also really encourage you to think about consent as a process, as a choice that involves people of equal power, right? And that it's active. It's people, right, recognizing body language to know that this is that 100% enthusiastic yes. So this is more of that language, right? That we're saying it is not always black and white. It is not just a box to check off, right? The person said yes or the person said no, but are we able to recognize some of these other pieces that are part of empathy-based consent? Empathy-based consent is more than a yes or a no. It's being able to read body language. It's being able to recognize other people's boundaries. It's being able to understand another person's perspective, that what one person might be really enthusiastic about, someone else is not. Right? And knowing that people each have the right to their own wants and needs and personal space and boundaries and perspective, right? And it's learning how to cope with no, right? When someone says no to something that you were really hoping to be able to do, how do you cope with that no? That's the language of consent. These are the elements of consent that go further than looking at it as simply a yes or a no. When we talked about, when we looked at our FRIES acronym and the I that was informed, right, refers to informed consent, it's really important that we talk about some of these special considerations that can affect consent. Alcohol and other drugs are one of those. So we know that alcohol impacts our decision-making ability, right? It impacts our ability to have empathy for other people, recognize other people's emotions, recognize other people's personal space. And so we talk with young people about how it's a really dangerous thing to mix alcohol and other drugs with consent, because you can't be sure you're getting consent. And in fact, the New Hampshire law says if someone is not able to give informed consent, it's sexual assault. And a lot of young people don't know that, and they don't know the risk that's involved in mixing alcohol and other drugs with consent. And sometimes young people will say, but what if they both were drinking? And we talk about that, right? That in a healthy relationship, you want to feel like this person's looking out for you and they have your back no matter what. So would this person recognize that this is not something that you want to do, and they wouldn't take advantage of the fact that you were under the influence? And we'll sometimes say to young people, if you're using alcohol or other drugs to help you feel more bold and to help you feel like you can bring up sex, that's a dangerous thing, because you can't be sure that you and the other person would want to have that conversation or would want to be involved in that sexual activity if you were not under the influence. And, they'll sometimes say, if they were both drinking, right? What the law says is that if someone's not able to give informed consent, that's a form of sexual assault. And if adults find out, charges can be brought, right? Information can be given to the police and charges can be brought forward. The other piece that's really important to talk with young people about is the age of consent. So in New Hampshire, the age of consent is 16. So if someone is 17 and someone is 15, they don't meet the legal age for consent, even if the two people involved are saying, yes, we wanted to do this, and there was no pressure, there was no manipulation. They don't meet the legal age for consent, and it's considered sexual assault. If an adult finds out, that information can be, given to the police, and it's possible that there will be a charge brought. What the charge is going to depend on the sexual contact. It's going to depend on the age of the people involved, but most people who are convicted of a sexual assault have to register as a sex offender. So we want to empower our young people with this knowledge. What does the law say about sexual assault? Dangerous to mix alcohol. What is the legal age of consent? Empathy-based consent, right? All of these pieces that help them to become more fluent in that language of consent. And an analogy that was brought forth to us from the One Love Foundation, that there will be information listed in the resources about that organization. But they talk about, right, if someone is driving when they're drunk, right, alcohol is not the excuse. They still drove drunk, and that's against the law. So if someone is under the influence and they commit a sexual assault, the alcohol is not an excuse. The law looks at the fact that they took advantage of someone who could not give informed consent. So it's helpful to just have those tips to be able to talk with young people about, should they bring that up, right? That we wouldn't say, oh, well, the person, they caused an accident or they hurt someone because they were drunk, so they're not at fault, right? Sometimes that's an easier analogy for them to make in thinking about drunk driving and then thinking about alcohol and sexual assault. So again, Turning Points Network is one of 12 programs in the state of New Hampshire that provide similar services, prevention education in the schools, and outreach and workshops for the community, as well as support to people who have been impacted by sexual assault. So please know we're available as a resource. Our contact information is on this slide. There will also be additional information in the resources section, some great videos that you can use to start some conversations with some young people in your life. Thank you so much for watching this virtual workshop. And please know we're available if you have questions. And also we love to know, how are these conversations going for you? And if you have great resources to share, we like to connect other parents and caregivers and educators with that information. So thank you again. Take care.
Okay, well, we really hope that you enjoyed this presentation. And again, I just wanted to reiterate, if you have any questions or comments that you would like to address to the group, you can email us at info@uvaltogether.org, as you can see on the screen here. And again, reminder that there will be different resources that will be available to you, either in the description below on this YouTube link, or we also will have a Keeping Your Teens Safe toolkit available for free. So spread the word. If there's any topics that you would like us to address in the future, definitely send us an email, and we really hope that you enjoyed today. Thank you so much. Have a great night.